Hey mom friends, this is Functional Medicine for Moms, where we look at motherhood through the lens of functional medicine. I'm your host, Kelly Moline, a pharmacist with advanced training in functional medicine. From pregnancy and postpartum to everyday parent life, we talk root causes, natural solutions, and real stories from our own family's journey, plus conversations with experts along the way.
Alrighty, kick us off.
Welcome back to another episode of Functional Medicine for Moms. I'm Kelly.
And I'm Landon.
And today we're talking all about GLP-1s and what that means. So think Ozempic, Wegovy, Mounjaro, all of those are GLP-1 shots, medications. They're the weight loss injections that everyone is talking about. Unless you live under a rock, you've definitely heard of them.
Yes, I have several friends, coworkers that have taken it.
Yeah, me too. So we're going to talk about what the medications are actually doing, who they're for, and what women should know before jumping in. Or maybe you want to know more about the medication you are taking, because I want to be really careful. I know a lot of people listening are likely on the GLP-1 medications or have taken them in the past. And so I'm not trying to shame anyone. This is not an anti-medication episode. If you've listened to my stuff or know me at all, you know I'm a pharmacist and a functional medicine provider. And I do not like medication as a first route for many cases. This is not... And this, including this, but they can be used as a tool. So we can talk about that. I know there's a lot of opinions out there, and so I wanted to give like a clear, honest breakdown and give people more informed decisions.
Sounds good.
Do you have anything to add before we jump in?
I was kind of thinking that Mounjaro sounds like the mountain Kilimanjaro.
Okay.
That's where my mind initially went. But no, I'm just kidding. I don't know much about these medications. They seem to work for people, but I have had friends that have gone off of them and gained all the weight back and sometimes more than they originally had. So that's where I feel like you have to change your lifestyle and your diet with them, or else like you'll have to take that medication the rest of your life. So, but yes, I am excited to learn more about like what they actually are and what they do, and
I'm surprised we actually haven't done an episode on this yet, and I think most of it is because I am talking about them so often that I almost was like, I need to talk about them for a whole episode, because I feel like I'm just around them a lot with my job as a pharmacist. I work at a compounding pharmacy where we are making these every day and providing them for prescriptions. And so I am around them a lot. And so let's get into it. What are the GLP-1 medications? So we talked about them again, like Ozempic, Wegovy, Mounjaro, Zepbound. Those are going to be the top ones that you'll likely see. They're once weekly injection. And you can also get compounded versions, semaglutide, tirzepatide are going to be the top ones there too. And then GLP-1s, that it stands for glucagon-like peptide agonist. And so this is a hormone your body naturally makes after eating. It helps regulate your appetite, your blood sugar, and it slows your digestion. And so these medications help mimic that signal, and they are attaching themselves to receptors. So they're like a hormone that you're putting into your body. They're peptides. So they're attaching to the receptors that the hormones your body naturally produces to those sites, and they attach stronger. So they work much better. And these medications have been around for a while for type 2 diabetes, and then they had the effect of weight loss as well. And so for type 2 diabetes, they're to help control the blood sugar, to lower the A1C, which is what they do. But they found that they had this other effect of weight loss, which could be really helpful for type 2 diabetes. And then they came out with these medications that are at much higher doses. So I hear a lot of people saying, well, these medications have been around a long, long time. And even the GLP-1s, I wouldn't say have been around a very long time for diabetes, but just in the past few years have they been at these high doses for weight loss. So this is not the same thing as what people were taking just for diabetes, because that's at a much lower dose, like a fifth of the dose from what people are doing with.
You're saying that like people with diabetes were taking a much lower dose.
Yeah.
For the last, so many years, but yeah, that now for weight loss, people are taking a much higher dose.
Yeah. So like Zepbound and Wegovy are actually FDA approved for weight loss, and those are at much higher doses. You can also do the Ozempic and Mounjaro at higher doses too, but for weight loss, they're used at a lot higher doses than what they were used for diabetes.
Got it.
And so, yeah, they're prescription medications. They're not supplements. So they change some of the signals that influence hunger and metabolism while also helping your body improve its response to sugar and insulin. So let's get into how they actually work in the body. So these medications help increase fullness, reduce cravings, and lower the food noise. I hear that a lot.
Increase fullness, like they make you feel more full?
Yeah.
Okay.
And how they do that primarily is slowing down digestion. So from the food moving from the stomach to the intestines, it's called slowing gastric emptying. So it's slowing down the food moving through the system, but that causes a lot of side effects too.
I was gonna say, wouldn't that cause you to get backed up then, or?
Yeah. Well, yeah. So it can cause nausea is one of the biggest, and then constipation, some diarrhea, reflux, a lot of that. But that's a primary reason of how it works to help keep you full. But also, if you're really nauseous, you probably won't be eating a lot because you're nauseous. So that's also one of the ways it can be helpful for weight loss, which is not the best way, obviously. And then for blood sugar, it helps your body release insulin when needed. Insulin is the hormone that takes the sugar into the cells, so we don't have a lot of sugar in the blood. And it helps lower glucagon, which is a hormone produced by the pancreas, which glucagon raises blood glucose levels or blood sugar levels by stimulating the liver to make glucose.
So it essentially lowers your blood sugar then?
Yeah.
Yeah.
So its goal is to lower blood sugar. So biggest things, it's going to increase the fullness, reduce cravings, reduce food noise. I hear that a lot. It's going to slow your digestion, and it's going to help your body respond better to blood sugar by increasing sensitivity of the insulin and helping the body respond to the blood sugar by creating insulin when needed.
Okay. So those, seem like they could be helpful things. They don't seem like too unhealthy.
Yeah. So, right. So how that helps people is really with people with insulin resistance. Do you know what insulin resistance is?
I'm going to say it's probably a resistance to insulin.
Yeah.
No, I don't know what it is.
No, that's pretty good. So it's when your body creates a resistance to insulin. So when your body has a lot of blood sugar, your body produces a hormone called insulin. Insulin is a hormone that helps shuttle the sugar into the cells as needed. Well, the cells get full of sugar and they don't want this. So they say, nope, I'm full. And then they keep the sugar out into the blood. Well, that just makes the body create more insulin to push the sugar into the cells or create fat and for storage. And it keeps creating this where the cells see insulin all the time, so they kind of stop listening. So it's like when you're the mom and you're always saying no, 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 and then the kid is like, they don't even know what that means anymore because you're constantly saying it. You're like the nagging mom, the nagging wife.
They think no is their name.
Right. So when we like cut that down, then we can find it effective again. So it helps that instant. So it helps insulin resistance. It helps pre-diabetes. It helps obviously type 2 diabetes.
The GLP-1s help?
Mm-hmm.
And so, okay.
Yeah. So basically pre-diabetes is insulin resistance, but you will see insulin resistance before pre-diabetes if you're testing for it. And then it'll help obesity, especially when obesity is caused by insulin resistance. It can help PCOS because there's a lot of insulin resistance in PCOS, typically, not always, but typically. And then if you have a lot of cravings, it can help that. Or if you've just tried a lot of things and things aren't working for you, it can be a tool. So it's not really like lack of discipline. And so sometimes we can use this as a tool to help get rid of that weight too and help your body respond better. Hey, really quick before we jump back in, I just want to share this in case it's meant for someone listening right now. If you're a mom who feels like you're just surviving the day, relying on caffeine just to function, or if you've been feeling off in your body, even months or a year postpartum, you are not alone. I also work with women who are trying to prepare their body for their first pregnancy or their next pregnancy and want to do it a natural, proactive way. Through my functional medicine practice, I offer a health analysis appointment where we really take the time to look at your symptoms, your health history, your lifestyle, and decide which labs would actually be helpful for you. That might include things like cortisol and hormone testing, gut health, metabolic health, and more. And all of these labs get shipped directly to your home, so it's very convenient. Once results come in, we walk through them together so you can fully understand what's going on in your body, and we build a personalized supplement and health plan with optional coaching support as well. The goal isn't quick fixes, it's optimizing your health naturally and giving your body what it needs to heal the way it was designed to. If this sounds like something you've been needing, you can find the link in the show notes to learn more or schedule a call. All right, let's jump back in. So, the downsides and what I want people to know about GLP-1s. Again, we talked about the side effects of nausea, bloating, reflux, all of that comes with the slowing of the digestion and how that is working, and that can help keep you full longer, but it also has a lot of those side effects, which definitely happens at the beginning, and that's why the doctor starts at a lower dose and then increases the dose as the body can tolerate higher doses faster, or can tolerate higher doses as it gets used to the medication. But if you stop the medication for a while, or even for more than a week, you typically have to go back down and start at the low dose and titrate back up. So the body kind of creates that tolerance for it, but also most of the symptoms usually go away, or you're able to tolerate them better. But if this medication isn't for you, that's those side effects, if they're not going away, the medication usually isn't for you. So if you're constantly nauseous, or if you're like, if it really puts you out, I wouldn't recommend this for you. Also, we have a lot of nutrient absorption issues from these medications because we're slowing the digestion. We're also not going to be absorbing the nutrients as well. And then people are eating a lot less with these medications. So what you're eating is super important. So if you're eating less because you're not very hungry with these medications, we need to make sure that what you're eating is really high quality, nutritious food. So proteins, healthy fats, fruits, vegetables, all of that to get our nutrients in.
Can that like affect if you're on GLP-1s and you're eating like crap food from like fast food or whatever, In-N-Out or whatever, will that like affect your gut health and like give you brain fog and all these other things?
Yeah, so that can definitely contribute to like fatigue because your body's not getting the nutrients it needs, and the calories it needs probably as well. But yeah, if you're just having calories and not having nutrients, that's gonna affect a lot. And then your gut health, I will say I feel like these affect gut health just because they're slowing everything so far down, and gut health is really the center of our health. So it does scare me of like what we don't know about these medications, because I feel like it could really drastically affect gut health. And that's so important for all the reasons I listed in previous episodes. So that's not something that's normally
You're talking
talked
like
about.
more the long-term effects because we just don't know what we don't know.
Yeah.
I mean, it like can end up being that it's great for gut health too, but yeah, I mean, there's just that ambiguity that we just don't know.
Yeah. And what we do know though is a lot of people aren't eating enough protein. They aren't eating enough of the right foods. I've had a person, I remember when this all started, and a guy came in and he's like, "This is great. I haven't eaten in 3 days." I'm like, that's not good at all. And then I've also have, people come in and I was trying to counsel on like lifestyle and diet, and they're like, "Oh, I don't need that. I'm going to be on this medication." I'm like, it's not one or the other. It's both. Like, this is used as a tool, and with any medication, I recommend using the lowest dose for the shortest duration of possible, because with any medication, there has risks. There's benefits and there's risks, and you have to weigh them for each individual. But to reduce the risks, lowest dose for the shortest duration will always help that.
Yeah, I mean, in true functional medicine form, though, like lifestyle and diet, like getting those and having a good like diet and having a good lifestyle and being active, things like that, they're always going to be good for your health regardless of what medication you're on for the most part. So it's like, well, like you still want to take care of that. So what is the reason that people like rebound so drastically when they come off of this? Like I'm just thinking of a few people that like when they lost a bunch of weight, but then when they got off of it, I mean, I felt like it was like within a month they were right back to their original size, or even bigger.
Let me get to that.
Okay.
And don't let me forget that. But I want to just go over some like other things I've seen with these medications. I've seen people go to the ER. I've seen gallbladder issues where they've had their gallbladder out. There's definitely issues of people losing eyesight, people getting osteoporosis, people having more depression or even suicidal thoughts or ideations, because again, this affects gut. Serotonin, the happy hormone, is made in the gut. So we're affecting all of that in the gut health. And so, yeah, osteoporosis, we're not absorbing the nutrients for the bones. And so that can cause the bones to be more brittle. There are risks with any medication. Like we talked about, a lot of people, and this will come into your question, they're losing a lot of mass and quickly, and that is fat mass and lean muscle mass. And so you're losing both. And especially when we're not eating enough protein and we're not adding strength resistance or resistance strength training to a regimen, then it's harder to maintain the muscle. And so when we're losing a bunch of fat and muscle, and then you get off of the medication that was helping you, when people stop the medication, it doesn't have these like long-term effects in their system. And when we never change the root, which would likely be lifestyle, diet, all of that as well. So if people who are coming in saying, I don't need to do that, I don't need to make changes, I'm on this medication, well, they never change it. And then they get off of the medication. They never change those issues. They're still eating what they used to. And now the food noise comes back. The cravings come back. And so they're gaining the weight. But they're not just gaining what they lost because they lost fat and muscle. They're gaining primarily fat back. So now we're in this instance where we have more fat than muscle, which is not a good thing. We need muscle for longevity, for our metabolism. So we're really can be in a worse case. And so I see most people who have tried to get off of it and they've failed, and then they get back on some sort of lower dose that they call a maintenance dose or microdosing. And it's really just a ploy to like not solve the root issues, and the pharmacies are still making money. The doctors are still making money. The doctors are happy that their patients are skinny, and the patients are happy, but kinda, I mean, they're still on this medication, but so it's just what your priorities are. But did we get to the root cause? You know, was it something else going on in the system? Was it a diet? I think I hear the most from people that really did try was like, I tried the diet, I tried the exercise, and nothing was budging. Like I was doing all the right things. And maybe you did get like hormones checked as well, but getting further testing, is it a food sensitivity issue? Is there a gut health issue? Is there a pathogen? Do we have detox issues? If your liver isn't detoxed, or if your liver isn't able to detox, that's the liver's job, is to detox. And if there's a lot of toxins love to be stored in fat. So the body thinks it's very dangerous to get rid of all the toxins that are stored in fat, so just keeps it in the fat. So if we're able to help the liver and help it work better, then it can process the toxins that are in the fat and get rid of the fat easier. So there are a lot of things that really aren't looked at. And in this day and age, people are like, oh, I'm looking for a GLP-1. They go to the doctor. That's the easiest appointment a doctor can probably do right now is this patient wants a GLP-1. Here's a GLP-1. They leave. They're happy. That was a quick appointment. You know, and I hope the doctor is obviously like doing more than just that. And it probably depends on the doctor themselves. I'm sure there are doctors that do more than that, but that's where we are right now. And it's a little scary raising a daughter in this like time where you are skinny. And if you aren't skinny, you should be on a GLP-1.
Yeah. That's not necessarily the world or the ideal situation that you want to raise her in, as far as like
body image and health. And like I said, I think they're overprescribed for sure, and they can be used as a tool. But do I think that a person with a BMI of 28 needs to be on a GLP-1? Probably not. You know, do I know their full history and if they have insulin resistance and all of that? No, but I'm saying I feel like there's a lot more we can do before we are injecting something into our body that we can look at. But again, it is a little bit the easier way right now. And for the doctors, they don't need to dig deeper. They can just prescribe this medication. So that is what I have to say on it.
Yeah. I mean, everyone will make their own judgments on what's right for them. And I mean, some people don't have the time or the money to put into like a big program to get them there. So I mean, everyone's got their reasons. And so I mean, to each their own. And
yeah. And again, I don't want to demonize the medication all that much. So if you are listening and you are taking a GLP-1 for whatever reason it is, and maybe you're just one of those people that went to the doctor and the doctor was like, this is what you should do, and you're like, all right, let's do it, and now you're like reading more, researching, and you're like, wait, maybe this wasn't the answer, but it's helping or something like that, then I just encourage you to, one, try to use the lowest dose you can while still getting the results, and the shortest duration. So if you're able to reduce dose, if you're able to get off of it when you can, that's great. But then also in the meantime, start building those healthy habits, whether that is going on a walk daily, getting that sunshine in the morning, getting the sleep. Like, you need to be able to sleep at night and put your body into a rest and recovery mode, to lose weight and to be healthier in general. You need to reduce stress, like all of those things that I preach all the time, right? Mm-hmm. You need to be eating the rainbow. You need to reduce processed foods from your diet. Cook at home when you can. That's really going to be the best way to do that. And yeah, move more, eat better, sleep more, all of those things. And then 2, if you're already doing that, you can definitely look for further answers, whether that is looking at cortisol levels, whether that's looking at gut health, whether that's looking at detox system, food sensitivities, all of that. So then at least we can understand the root. So when we are trying to reduce dose or get off of this medication eventually, we can help your body get optimized so we don't have to rely on this medication long term.
Well said. Spoken like a true functional medicine / pharmacist consultant.
Yeah. Well, I started this episode going, I'm going to keep this really non-biased, and then here I am.
It's better that way.
Okay.
Just let it out.
Yep. Okay. Those are my thoughts. So let me know if you have questions on that.
All right.
Okay. Do you have any thoughts on it, Landon, or questions or closing remarks on GLP-1s?
No, I mean, it sounds like it does a lot of good things, and for a lot of people it may work and it may not be a horrible thing, and there might not be long-term bad effects of it, but I think the answer is always to just have a better lifestyle and diet and live as healthy as you can, whether you're taking the medication or not. But yeah, I guess we don't know long-term effects of taking this medication at a high dose. So,
well, yeah. And we know some that aren't good, like I described earlier. So we definitely know that there are some negatives.
Some long-term effects,
like
that are not good.
Like people getting their gallbladder out, like people losing their eyesight. Like, we already know those things.
I guess we haven't been doing this for a long term yet, though. So I'm talking we don't know other long-term effects of what else could happen in the long term. Does
this cause cancer and things like that?
Yeah, you just don't know. I mean,
there's always the risk. We know of these risks, and then there's also risks that we don't know, the unknown risks.
I mean, anytime you're slowing your body's digestive tract down and system down in any way, shape, or form, and you're manipulating how it's made to function, to me, I'm oh, yeah, there could always be things that go wrong in that area. But sometimes for some people though, especially pre-diabetics, things like that, they need this. I mean, it does a lot of good for them. So
they need help, and this can be a tool in their toolkit.
Yeah, that's what I'm saying.
Yes. Yeah. And don't get me wrong, this medication I know has been life-changing for so many people.
Yeah.
And so I think that is
a lot of people
fantastic.
off. No, just kidding.
I'm just saying, I feel like that is fantastic, and I'm so glad that you got the help you needed by using this medication, and I hope that the progress continues for you and you're able to feel healthy long term.
Yeah.
Whatever that's route
always
looks
what we
like
want.
for
That's
you.
why you got into functional medicine in the first place.
Yeah.
You want that for everybody. So
Yeah. Anyway, okay, Landon, finish it up with a dad joke.
Okay. Good segue. All right. I'm just remembering one off the top of my head. Did you know they actually found that you don't need a parachute to go skydiving?
I'm not going skydiving. So you don't need a parachute?
Yeah, you don't actually need a parachute to go skydiving. You just need one if you want to go twice. That's a darker one.
That's a dark humor. Okay. Well, with that, please subscribe.
Like, subscribe, share it with your friends.
You can follow us on Apple Podcasts or on Spotify. You can also comment on Spotify podcasts as well. Share with someone who may be thinking about GLP-1s or have taken GLP-1s and just want to know more about them. And yeah, we're here talking about mom stuff and functional medicine.
Yep.
Glad you're here. All right.
Thanks for listening.
Bye-bye.
Bye.
Thanks so much for listening to my podcast, Functional Medicine for Moms. If you enjoyed today's episode, make sure to subscribe so you never miss one, leave a quick 5-star review, and share it with your mom friends who love it too. I'm Kelly with a background as a pharmacist and training in functional medicine. I help women move past fatigue, brain fog, gut issues, and hormone struggles so they can thrive in everyday life or prepare for a healthy pregnancy. Through lab testing, personalized supplements, and functional medicine coaching, I help you feel better, faster, naturally. Want to connect more? Head over to molinmethod.com or come hang out with me on Instagram and YouTube at Functional Medicine for Moms. On my site, you can order professional grade supplements at my discount or book a free discovery call if you'd like to see how we can work together on your health. This podcast is for educational purposes only and not medical advice. Always talk to your provider before making changes to your health plan. And remember, healthy moms raise healthy families. Catch you next time. New episodes released every Wednesday.